welcome to Health Occupations. My name is Mrs. Smetak.
My name's Mrs. McCreary.
And I'm Mrs. Miller.
And we are the 3 instructors for Health Occupations Technology at EWCTC.
At this time, we're going to take you into the classroom and take you on a tour of the different activities and the skills that students learn all 3 years here. So come on in.
The Health Occupations Technology class is designed to help students explore different healthcare careers along with extensive medical terminology through anatomy and physiology, which prepares students for college and careers after high school. During students' first year in the Health Occupations class, they master such skills as vital signs, learn CPR with the AED, learn how to use adaptive equipment for patients that may have had surgery or had a stroke, and they administer eye exams for their patients. Second-year students enroll in the Certified Nurse Aide Training Program. Students learn basic nursing skills such as bathing. They learn the complete bed bath as well as a partial bed bath. They learn how to dress their clients. Students also learn how to feed their residents. They learn about therapeutic diets. They learn about mouth care, using a toothette or a swab. We also partner with a local nursing facility so that the students can have real-life experience to complete their CNA training, which is a total of 40 hours. After successful completion of the CNA program, students are eligible to take the Nurse Aide State exam, which they take here at the school.
Welcome to the 3rd year of Health Occupations. It's medical assisting. We have an entire doctor's office built for you to practice your medical assisting skills. Most medical assistants work in doctor's offices, hospitals, or clinics. Medical assisting students are trained to work in the administrative end of medical assisting, which they would learn how to answer phones, schedule appointments, code insurances, and collect copays. The clinical end of medical assisting involves helping the physician with an exam in the exam room. Students are taught how to do an exam on an infant all the way up to the elderly patient. Several things happen during a physical exam. A lot of times a physician would like to have a specimen. The students are taught how to take, process, and send away for examination urine specimens. It is also necessary at times to help a patient with their medications. While medical assistants do not dispense medications, they are able to help the patient organize them and keep them in their home safely. Checking a patient's blood sugar level is also another important task that usually happens during a physical exam. The students do learn how to use the equipment and to perform that skill. It is also necessary at times to give an injection of medication during a physical exam. Students learn the proper technique for giving different types of injections into a mold that simulates the patient's skin. One of the highlights of medical assisting is usually phlebotomy. That's whenever students are taught how to withdraw blood for laboratory testing. We do have multiple types of mannequins or simulated devices that allow the student to perform this task safely and without any exposure to blood or body fluids. Learning how to do an ECG or an electrocardiogram is something students perform on a mannequin as well as on one another that measures the electrical activity of the heart. This is something that once students graduate, they are able to pursue as a secondary certification. Medical assisting is one of those areas in healthcare that affords its employees the ability to work a 9-to-5 job without the long hours of evenings and weekends.
So if you have an interest in healthcare, this program is for you. We will help better prepare you for your future.